You're welcome to this week's episode of the PV Show. On this week's episode, we are taking a look at Hello, you're welcome to this week's episode of the PV Show. If you are joining us for the first time, remember to click on the subscription button to subscribe to the PV Show. So on this week's episode, we are taking a look at dealing with childhood cancer. I'm sure you might be wondering what childhood cancer is all about. So on this week's episode, we are privileged to have a nurse who works at the pediatric oncology unit at the kole-bu teaching hospital. She's joining us to tackle childhood cancer. You're welcome to the show.
Thank you very much.
Wow, it's a great honor to have you on the show again.
Thank you.
Okay, so you give us a little introduction about yourself.
Okay, so Mrs. Messiesi Calistego. I work with the kole-bu teaching hospital, specifically the pediatric oncology unit, and I'm married to Reverend Father Jehoshaphat Calistego, and I'm blessed with a child.
Wow, yes. That's great. Okay, so today we are taking a look at childhood cancer. When we talk about childhood cancer, what is it all about?
So like the name rightly said, cancer that affects children.
Okay.
So that is childhood cancer. So we have even babies, starting from babies to let's say adolescent, 14, 15 years, yes, thereabouts. So cancer that affects children, like the name rightly said, childhood cancer.
Okay.
So yes.
Okay. You just gave us an idea of what childhood cancer is all about. But then for someone out there who may not even understand what cancer is, what is cancer at all?
Okay, so cancer is abnormal growth of cells. Okay, so when you are born, or when most of us have done science in our various school, and the stages of life is we have chemical formation. When one is born, they said chemical. Then we go to cell, tissue, then organ system, organelles and organ system. So now when one is born, it's the cells that makes up your tissue. So let's assume your breast. Before you have the organ called breast, it starts as what? Cells. Okay, then these cells, similar cells form together, then they become tissue. Then the tissues become the organ, which is your breast. Okay, so in through the process of the cells, cell forming up, when there's any abnormality or anything goes wrong through the formation of an organ, or when something wants to form or an organ wants to form in the cell processing form, when there's any problem over there, then we say that thing may have developed cancer. So an abnormal growth of cells is what we call what? Cancer. Okay.
All right, but looking at childhood cancer, do we have types that are common in children?
Yes, with childhood cancer, there are a lot, just like adults where we have a lot of types or common cancers among them. With children, we have some common cancers. We have the leukemia, which is the cancer of the blood. So with the leukemia, we have two types. Okay, so we have the one that medically we call it the ALL, which is the acute lymphoblastic leukemia. And it is the most common type of leukemia, and it is treated, like here in Ghana, it is treated. But then the other one that seems to be severe is the second type of leukemia, which is the acute lymphoblastic leukemia.
Okay.
And in fact, Ghana, we don't have so much in treating this particular type of cancer. So most of the times we refer them to South Africa, UK, and other countries that have the things to treat that type of leukemia. And apart from leukemia, we have the cancer of the eye. We call it retinoblastoma. Okay, so reti is eye. Where's retino? Okay, it's eye. So retinoblastoma. Okay, so it's cancer of the eye. Then we have lymphomas. They are cancers that affect our lymphatic system. That is our lymphatic systems they are the things that helps in fighting diseases. Okay. So we have certain cancers that affect our lymphomas or our lymphatic system. Okay. Then we have cancer of the bone, which is called osteosarcoma. Okay, so some people, and most of the times with cancer of the bone, it happens to children in their adolescence. Okay. So, you would see them, with someone from the ages of, let's say, 11, 12 going with that. Okay, so with the cancer of the bone, we have the osteosarcoma, which is for children around that age that I just mentioned. Then apart from that, we also have so I've made mention of leukemia. I've made mention of, we have rhabdomyosarcoma. Okay, it's another type of cancer. Then we also have Worm's tumor or kidney cancer. Okay, so that is
children too.
Yes, they do. Wow. They do. We have children who have cancer with both their kidneys. We have children who have cancer at just one part of their kidneys. We have children who are just born with one kidney, and guess still they have cancer with that kidney. So you can imagine what children are going through. Yes, some children are unfortunately going through.
Okay, so what actually causes this childhood cancer?
Okay, so cancer in general, the cause is unknown. Okay. Being it adults and in children. Okay. The cause of childhood cancer. Being it adults and female, the cause of childhood cancer is unknown. Okay. But there are certain things that can predispose, one to getting cancer. Okay. Unlike adults, we have so many predisposing factors or things that can make an adult get cancer. An example is, let's say an adult or a male adult who likes smoking, or even a female. There are females who smoke anyway. So a chain smoker or someone who smokes frequently, the probability that the person can end up with lung cancer is high. So in that case, when the person is being attended to by a doctor or something, with the history being taken, the doctor can conclude that, okay, based on the the female adult or the male adult who has been smoking frequently, based on he or she smoking, that is why she has ended up with the lung cancer. But with children, with the exception of some few cancers that we can attribute it to, let's say, being it in the family history. So one of the factors that is considered, like I said earlier on, the main cause of childhood or cancer in general is unknown. But with children, one of the factors that is considered is history, family history. Okay. And it's just with some few cancers, like cancer of the eye that I said is called retinoblastoma. Yes, that is one of the cancer that sometimes we ask if it is in the family, and so that we can get proper management for that child. But with the rest, it is just the cell formation. Okay. There is nothing much that we can say is the cause of childhood cancer. Okay, so
yes, now we know some of the causes of childhood cancer, but then how is it diagnosed?
Okay, so childhood cancer is just being you as a person, or you as a parent, or you as a caretaker. You need to watch out for certain things on your ward. Okay, or with your child, you need to be observant, okay? Because most parents, they are not even observant, okay? Or sometimes when the child is unfortunate to be in the hands of a nanny or something, the parents are not often at home. They go to work, they come back home late. How would you even be able to observe your child? Okay, so you just need to be very observant. So when you see certain things going on wrong, okay, with your child, I mean, anatomical makeup, I mean, the things, the body, I'm talking about the things on the body or even inside, okay, you need to just watch it out and, I mean, report to the doctor. And when this is done, there are lots of things that goes on into getting the diagnosis of a child, and then we can ascertain or we can say that, okay, this child is actually suffering from cancer or not. So we do a whole lot of things. I mean, a whole lot of labs actually goes in.
Okay. Someone wants us to find out what are the predisposing factors of childhood cancer?
Okay, so like I said, the predisposing factors, and there are no main cause anyway with both cancers in adults, whether adults or in children. There are no main cause, but they are predisposing. And like I mentioned earlier on, I said with children, it's just family history, genetics, okay, and it's just considered in just one or two types of examples of the cancers. And an example is the retinoblastoma, which is the cancer of the eye. That sometimes we ask questions like, is someone in your family who has it? Have you seen anybody? Yes, so just some few cancers anyway. But with children, we don't have much predisposing factors, because you can't say, oh, this child wants to smoke. No, I'm not cancer cougher. Cigarettes, no, we're you get it. So we don't have much factors as with children as compared. It's just that we need to be extra careful. Parents, when they are spraying their rooms, I mean, using those aerosol sprays and those things, I mean, insecticides and those things, you need to keep. It might not happen now, but you are just changing. You know, when those things get, and even you adults, when you inhale those things, it can change things in your system. So when we are using such things, we just need to be careful.
Okay, so as a parent, what do I look out for in my child to be able to identify if this child is having any childhood cancer? Okay,
so what you as a parent or a caregiver needs to look out for in your child, and we should all bear in mind that these things I'm going to mention, unless you come to the hospital, then various diagnostic tests are being done to finalize and say that this child or child A or child B has cancer. Then with this signs and symptoms or the things I'm going to mention, does not mean that immediately you see it on your child, it means your child have cancer. It is just by you bringing your child to the hospital that can make you know if your child have cancer or not. So one of the things you can see on a child or you can look out for in your child is a child who frequently have low HB, a child whose blood level, whose blood level is always low. This child will complain of easy fatigability. The child is always tired. I mean, the child plays more, no, she just finds somewhere and go and hide and, I mean, bend down or something. The child is often tired. The child has frequent loss of appetite. The child is not able to eat. And a child who has any swelling at any part of the body. So the child has a swelling around the neck, swelling at the jaw, I mean, swelling at any part of the body, the abdomen. So probably the child's tummy is becoming big. The child is not eating. The child has eaten just a little, but you realize the child's stomach is big. And each and every day that passes by, the stomach is becoming big. So you need to take, when you see all of those things, and some of the children, we call them, I've forgotten the medical name given to it, but like a child who is looking at you but looking at another place.
Me baby.
Me baby, you know. I mean, sometimes when you bring it to the hospital, it does not mean that all these people, some of them, but It is one of the things we look out for with someone who is being diagnosed of cancer of the eye. So the Mishami baby, the English word is strabismus. Okay, so people who you've given birth to a child who is look, you are talking to the child is looking at you, but directly, in fact, the eye is somewhere else. Okay, so you need to bring the child to the hospital. We assess the eye. Okay. You do further labs, and we know. Then apart from that, a child who has something on the eye, some of the children, you take pictures of them. It's not like it's a flashlight, but you see lights on their, people. Wow. Okay, the dark one on her eye. Yeah. You see lights in it. Okay, but it's not because of your flashlights. Flashlights are different. That one, fine. Okay. But if it is not flashlights, but you can see lights in that dark part of our eye, you need to bring that child to the hospital. It could be cancer of the eye.
Okay. What role must parents or caregivers play when it comes to children with childhood cancers?
Okay, so children living with childhood cancer, the role that you need to play, the role could be before the child is being diagnosed of having cancer, and that role just needs to be observant. Okay. Every parent or every caregiver needs to be observant about the physiological aspects. Or when a child is growing, you need to be observant. Okay, my child came with a smallish hand, but it looks like the wrist is becoming big. Okay. The bone in the wrist is becoming big. My child came with no swelling jaw, but now the jaw is becoming big. Okay. So you just need to be observant. So when there are any deviations in the physical parts of the physical appearance of your child, then you can just go to the hospital. And when your child is being diagnosed of cancer, don't think it is any fault of yours as a mother. Okay. Or probably the lady will also end up blaming the husband. Probably your sperms, there was a mistake in your sperms. We hear of such stories every now and then at our workplace. The man is blaming the woman. The woman too is blaming the man. Okay, so the parents need to come together and take care of their child with love. And not abandoning their children too and saying that, okay, let me go and leave the child with so and so. Maybe send her to my shrine at my hometown or a church and abandon. Yes, in as much as God has given us, the power to cast certain things in our lives away, He has also given unto everyone knowledge. We all have special knowledge. So the doctor is there for you, so that your child will come there and the proper diagnosis will be done, so that your child will be cared for.
Okay. But when we look at this childhood cancer, is there a cure?
Yes, childhood cancer is curable if detected early. Okay. So there is a clause over there which is if. Okay. So if you come early, it is curable. Okay. But if you stay in your home, you go and sleep with your child in a church, go to your shrine, believe it's some gods, just bring your child to the hospital as early as possible. Okay. Add prayers to it, and God will definitely do it.
Okay, but what happens with the ones that are not curable? For example, maybe the child comes late, or as in they bring the child at a time that the case is becoming intense, or probably looking at some children, maybe the case is to the extreme that nothing can be done. What can parents do about these children?
Okay, so I would want to say something. We don't have any cancer that is incurable. Really? Cancers are curable. Like I said, they are curable when you come early. Okay. It can be cured when you come early. Okay. So when you don't come early, that is when sometimes it becomes very problematic. Okay. So just make sure when you see any of the things, the signs and symptoms I made mention of earlier on, you just bring your child to the hospital, so that certain the rest of assessment could be done so that this child will be taken care of. And with the mother who has brought the child to the hospital very late, that would be very unfortunate. But in such cases, because when someone's cancer has spread, the only time we say someone's cancer is in late is when probably it has spread to other parts of the body. Maybe the child came with leukemia, but now it has spread to or probably the child came with cancer of the kidney, Worm's tumor, but now it has spread to the lungs, it has spread to somewhere. And in those cases, the child already having the cancer is weakening the child. So when we do further things, but with that, it even has to do with the doctors sitting down with the parents and telling them the realities. And based on that realities, the parents make the decision themselves, because they tell you the facts at hand, that okay, your case already is not favorable. So when we give the chemo medications are also strong. So when we give it to you, this and that is what is going to happen to your child. Do you want it? Some parents say yes. Others say, okay, no, you discharge my child and let me take him home or her home. So yeah, this is what actually happens.
Okay. Before we touch on the role governments must play, we've already touched on the role society must play in this regard. But then, do we have some misconceptions surrounding childhood cancers? Do we have some misconceptions?
Yes. You know, in most of our settings, people believe that certain diseases, or some people even believe that most diseases are spiritual.
Oh yeah.
Yes. So instead of them dealing with it physically, they actually listen. Of course, everything that happens in the physical realm also happens in the spiritual realm. So in as much as the devil has attacked you, let's say you have diabetes, you are experiencing the signs and symptoms of diabetes. It doesn't mean that because you believe it is physical, your sugar level is going up, you'll be eating, then like you take your breakfast, a lot of sugar is in it. No, you are killing yourself. In fact, quote and unquote, you are being a fool. So you need to take care of yourself. So the misconceptions people have about this is that sometimes people come and they think it's a spiritual. Yes, they are free to think whatever they want to think about. But whilst you're thinking it is spiritual, you need to think about also dealing with that thing in the physical aspect. And others also believe that probably it is something that they did, some food they ate. Some of the women, when you sit down with them, you could realize that they are so much psychologically affected by what is happening to their child. So they will ask, Antinette, was it something that I did? Can family planning be the cause? The family planning I did before my pregnancy, can it be the cause? I mean, all of these things does not have facts. Now, scientists have never read anywhere where these things are facts anyway. So, in as much as this thing has already happened, just move a step forward or ahead by bringing your child to the hospital, because it has already happened. And let the people with the right knowledge take care of your child.
When some of these things happen, let the right people take care of the situation. Don't just go to anywhere to seek for help, but rather make sure you visit the hospital so that the issue can be tackled. But before we go, what role can government play in this regard?
What I can say here is that we need the government to assist us in taking care of these children living with cancer, because some of them don't have much. Some of the parents don't have much. Some of them don't even have at all. So they come to the hospital. Even the cheapest chemotherapy medication does not even cost 50 cedis. You don't even have money to buy it. So I believe that just like the government putting certain medications on the national health insurance, they can also infuse some of this medication or put it on the national health insurance and also support it. Yes, so we need much support, more support from the government. In any corporate organization too, we have a lot of people who are supporting us, and we say God bless you to such, and we ask for God's blessings to such organizations, and we are asking for more, because when these children become better persons or better people in the society, then we can all be beneficiaries of their betterment.
All right, thank you so much. It's a great honor to have you on the show. But before we leave, your final words.
Okay, so my final words is that cancer does not know the poor, it does not know the rich. Everybody can get cancer, and children, just like we have adults who are being diagnosed of cancer, we have children who are also suffering from cancer. So let's just, as parents or as caregivers, let us be observant of our children. We should we should look at our children every day. When we wake up, we go to work, we come back, we should give more attention to our children, so when anything is going wrong, we can detect it early. And apart from that, when one is sick, irrespective of what you have been diagnosed of, I'm speaking out of context, whether it's being cancer or anything, just seek the right medical attention and add prayers to it. Don't just ascribe it to any spiritual thing, then you leave out the medical aspects. And so with you doing this too, we hope that God would also see you through. And cancer is curable when detected early. Just take this to be part of you.
Thank you very much. Cancer is curable when it's detected early. Thank you so much for joining us on this week's episode of the PV Show. Parents, we are really pleading with you. Let's pay attention to our children. Let's pay attention to things that we think that may not be necessary. The next generation is very important to all of us. So please pay attention to our children, so that when there are some early childhood cancers, we can detect it very early. Until we come your way same time next week, make sure you wash your hand with soap and the running water, sanitize your hand frequently, and use your nose mask. Remember to subscribe to the PV Show. Bye.